Welcome, welcome, folks of wonderful District 1, County of Sonoma. My name's Alegria de la Cruz, and I'm the Director of the Office of Equity, and it is my pleasure to welcome you tonight and to walk through a little bit about what we're doing here and what to expect. So first things first, if you have questions, don't worry. There's lots of space for questions. What we're asking folks to do is to drop your questions into the chat, and we will do our best to answer them in the chat. Or if we don't get a chance to get to them tonight, we will be creating a frequently asked questions document that will then be posted up on our county's ARPA website. You can also email any questions you have to the email address that we're also dropping in the chat, arpa@sonoma-county.org. Thank you, Jake. So we are really excited because this night is about hearing feedback from our community. If you need interpretation, so si ocupas interpretación, hay un globito ahí abajo y nomás hay que hacer clic y escoger lo que es el español, el canal de español. ¿Me pueden dar como un dedo para decirme que sí está funcionando el canal de español? I'm sorry, I'm clicking through people's thumbs here to see. Gracias, Marisol. Okay, perfecto. And for those folks, many of us who are here tonight representing the County of Sonoma, if you could just also make sure that you're identifying yourself as a county person, that will be helpful to our community as a whole as we have these conversations. So thanks so much for reviewing these housekeeping items. And now we're going to jump into the agenda before I have the pleasure of introducing Supervisor Gorin. So tonight, what we're doing is making sure that we together as a community understand what ARPA is. ARPA is the American Rescue Plan Act, which is a very powerful, wonderful piece of legislation that we will be talking about what we want to do with it here in Sonoma County. And we will be discussing what the impact of the COVID-19 pandemic has been on our county's health, on the health of our county's businesses, and the overall impact that it's had on communities, with a specific focus on disproportionately impacted communities of color. We will then be taking some time to meet together in smaller breakout sessions to run through some of the questions that we are asking everybody to consider tonight. And then we will be presenting back to our community as a whole to make sure that we're sharing all of these incredible pieces of feedback and making sure that we are all on the same page as we move forward together through this process. So now with that housekeeping under our belts and the agenda well in your brains, it is my pleasure to introduce Supervisor Susan Gorin, who we're so lucky to have tonight. Supervisor, take it away.
Muchas gracias, Alegria. Thank you to Alegria and all of the folks who helped put on tonight's virtual town hall on. Really appreciate everyone's efforts. And hold on, I have to turn off my phone. I am Susan Gorin, and thank you for taking the time tonight to participate in our virtual town hall. I'm looking forward to hearing your thoughts and input that will help our board prioritize funding for the American Rescue Plan Act, better known as ARPA. Tonight, you'll learn about what ARPA funding is and how it will be distributed in Sonoma County. In addition, you'll have the opportunity to share personal experiences to help inform the Sonoma County Board of Supervisors as we set funding priorities for ARPA later this fall. Our community has suffered a lot over the last 4 years, multiple fires, floods, and of course now the COVID pandemic. We also know that disasters like these do not have the same impact on everyone in our community. Our Black, Indigenous, people of color, immigrant, and undocumented residents have disproportionately felt the impacts brought by all of these disasters. So let's talk a little bit about our current COVID-19 cases. As of September 16th, 376 Sonoma County residents have lost their lives to COVID-19, and we extend our deepest sympathy to those family members who experienced these losses. And countless others have lost family members across the state, country, and globe. We're deeply sorry for all of your losses, and we want to recognize the pain and suffering represented by these numbers. They aren't just numbers, they are family members. It means there are 376 people in our community who are no longer with their loved ones. So many others in our community were sickened, sometimes severely, and others still struggle with continuing symptoms for months or even longer. Over 38,000 county residents contracted the virus, which represents 7.6% of our county's total population. And we know that COVID-19 did not affect the community equally. And we see that in our case rates as well. The Latinx community makes up 58% of all cases, despite being just 27% of the county's overall population. At some points during the pandemic, up to 90% of our cases were in the Latinx community. In cases per 100,000, the highest rates were all among communities of color. I want to be clear, these higher rates are not because of something innate about our neighbors of color. This is because of multiple factors, but simply put, these communities are much more likely to work jobs on the front lines with more chances for exposure, or live in a household with those that do, and have less access to sick time, healthcare, or remote work options. The disparities that people in our community experience, especially our BIPOC and immigrant and undocumented residents, cannot continue as it is. Inequity harms all of us. It harms overall growth by decreasing per capita income, damaging health and well-being, and decreasing disposable income, and results in greater levels of unhappiness and mental health issues across our entire community. This is not about blame. It is about finding ways that the county can help out at this time of need. Tonight, we have an exciting opportunity. I'm glad to be here with you and look forward to hearing and learning from you on how we will prioritize these funds. Thank you once again for being here to participate in the process. And I would now like to reintroduce and welcome Alegria del Cruz, the Director of Sonoma County's Office of Equity, who will lead the next portion of our agenda tonight. Take it away, Alegria.
Thank you, Supervisor. I think we're going to go back to our slides here. And we're going to go to the next slide. So we really wanted to start by being as race forward as we possibly can. The Sonoma County Office of Equity has really helped us to shape an understanding of why it's so important for us to focus on race equity when we talk about equity. And this is because in our community, like many others throughout our entire country, from infant mortality to life expectancy to home ownership to COVID infection, race is still the single biggest indicator of well-being. We also recognize that race is a social construct. It was created to justify everything from the displacement of Native Americans and the genocide of Native Americans to the enslavement of African people. And it was also used to determine who could hold US citizenship. So from 1790 to 1952, US citizenship was granted only to people declared white by law. So when we look at these historical kind of undergirdings of where we are today, we really recognize the importance for us to understand the history of our communities and the way that they have suffered because of policies. Starting from kind of explicit racism, from slavery to Jim Crow laws that governed who people could marry and whether or not someone could vote or own property, moving into more explicit forms of racism. During this time, we've got a lot of laws that were overturned as explicitly racist, but then we slid into this kind of race neutral way of trying to normalize the situation that our country was in, but discrimination continued. And now we're in this place where we're really looking at these completely disproportionate outcomes for people of color in our community. And so the County of Sonoma's frame here is to say that we've got to explicitly see race. We've got to see it and we've got to address it head on. And we recognize that because it is the single biggest indicator that results in these outcomes, we really have to be race forward in the way that we look at solutions. And we recognize the importance of us as a government institution to look at how are we undoing the harm that government policies have created in past practices as we move towards a more equitable future together. And we recognize by centering communities of color, right, by pulling folks who have been most disproportionately impacted, who have continued to sit on the margins of well-being in our community, that we really start to design solutions that are focused and in that way improve outcomes across our county as a whole. Next slide. So we really want to get grounded in our county's definition of equity. And we want to also, as we talk about this definition, thank the amazing thinker, Miss Unique Redwood, for this idea that equity is two parts, that it's an outcome where you can't tell the difference in how healthy or well or wealthy somebody is by race or ethnicity. And that in order to change those outcomes, we have to create new processes. And so that's what we are doing here with ARPA, and that's what we are doing here tonight to really kick off that effort. So next slide, please. And to make sure that we're all holding really important questions in our heads as we jump into this conversation tonight with our community, we wanted to share in advance some of these questions that we will be asking you to think about and to share out in our breakout sessions. And as you think about the ways in which you will hear from Oscar Chavez and from Shiva Person Whitley, the ways in which COVID has impacted our county's health and our businesses and our community as a whole, these questions are going to really help us drill down into what are the opportunities that we have to jump into here with this powerful piece of legislation and the opportunity that's before us. Next slide, please, Jake. So we really want to talk about what the opportunity is. So first, the intent. ARPA is nice and clear that it's about making sure that we're doing three things, that we're continuing to support the public health response. ARPA was passed before the variant hit our communities in quite the way that it has. So there are additional needs. We continue to be in a disaster response frame. ARPA also really allows us to address the negative economic impacts caused by the pandemic. And so we'll talk a little more about what specifically what those details are about how we understand the impacts. And ARPA is very, very clear, and it recognizes that there have been communities that have been hardest hit and communities that really need us to step up in this moment to see and address the things that they need from us right now. So as we're thinking about that, we are also really framing this as an incredible opportunity. And as you hear from a group of us tonight, one of the things that I think I'm really proud of in this conversation is the way that this is a multi-departmental and multi-sectoral approach. So we recognize that people who are poor, people who are struggling, a lot of times their challenges don't fit neatly within the silos or the lines of our agencies and our specific mission or the work that we do. And so we are really working to make sure that we are working together across departments, across agencies, and lifting up those best practices. And in doing that, we're closing the gaps in those silos, because that's where folks tend to fall between, is those silos. And folks who tend to fall between those silos are the same folks who are disproportionately impacted by the challenges in our community. So by doing this, by centering those folks, by closing those silos, we are really holding in the middle of what it is that we're doing, kind of a holistic, whole person approach to how we are going to address the impacts of COVID in our community. Next slide. Our county has made some initial decisions in how we are going to be distributing money So the first decision was made in our budget hearings earlier this year, and we allocated about $20 million to our health department out of the 96 total that our county was allocated by the federal government. So that leaves us about $76 million left. And we're recognizing that there are two important ways in which our county and our community as a whole can work with us to decide how are we going to make sure that our county departments are able to use some of this money to really strategically invest in those, whether it's infrastructure or county infrastructure or human infrastructure, to really support an equitable recovery. And then we're also looking at how are we going to invest money directly into our community-based organizations to ensure that we're working together in partnership to address the challenges that our community has faced during the pandemic. Next slide. And if we're looking at these priority funding areas, ARPA, again, creates a nice list for us of things that we can do with this money. So we can help folks who have experienced unemployment throughout the pandemic. We're looking at kind of cash aid, helping people address their food needs, their housing needs. We can also make sure that we're giving aid to specific industries, small businesses or nonprofits who have been impacted, looking at investments, both in housing and neighborhoods and education, in early childhood education or childhood environments. And we can look at things like premium pay for essential workers. We're also looking at ways in which we invest in that infrastructure, whether physical or human or within the county. And we're really looking at how are we addressing disparities in those outcomes that our community experienced during COVID. Next slide. So one of the things that we're doing here is we're recognizing, going back to that definition of equity, we're recognizing that we have a process opportunity and a process solution to offer. And so one of the things that we've done here is create something called the ARPA Equity Work Group. And that group is made up of folks who are living and seeing these structural and institutional inequities. And as a result of their lived experiences, what they see in the clients and the patients that they serve, how we can flip those switches and make those tweaks and really elevate the wisdom and the great ideas that come from those lived experiences. So we are really excited to be working with a fabulous group of 15 people who represent in many ways the different communities who have been most disproportionately impacted by COVID. Folks who are Black, Indigenous, people of color, people who are LGBTQI, people who have experience with houselessness. And so I want to just read off the names of the incredible people that will be lifting up this work of doing the ARPA Equity Work Group with us in really coming together with making some very clear recommendations about what our priorities are, where our areas of focus are, and how we hold ourselves as a community and as a county accountable to what it is that we're doing. So thank you to Chelsea Rose, to Daniela Bravo, to Yvette Miner, to Faith Ross, to Grace Chung Schulman, to Gregory Fearon, to Hector Velasquez, to Herman J. Hernandez, John Wielden, Mary Sandberg, Patrick McDonald, Rebecca Samet, Regina Brennan, Roni Rubinoff, and Sandra Uribe. Next slide. And this is a little piece of how this is going to work. So we are starting right here where it says, Estaque, you're here. We are engaging our community. We're having these conversations, both with you here in town halls, as well as with the ARPA Equity Work Group. And then as we define a little bit better what those areas of focus are, where the opportunities are, we're then going to be pushing money out into our community through a request for proposals. And making sure that as we're pushing out money into our community, that we're also really looking very clearly at what those performance measures are that are going to help us to be very clear about understanding where our money is going and who it's impacting and how we're really moving the needle on those outcomes that we see right now is so incredibly disproportional, how we're moving to an equitable recovery from this pandemic. And as we look at those measures and how we're holding ourselves accountable, that will really give us an opportunity to monitor the progress that we're making in making those changes. Next slide. And here's a little bit about the timeline. So we are working right now to push out into our community a survey that will give us an idea of what the biggest needs are in our community-based organizations. And then working with our work group and in these town halls, really pulling out those key areas of focus. And those areas will go into a request for proposals, probably towards the mid to late January of next year. And then giving folks a good amount of time to come up with their best ideas about how to work with us in partnership. Those proposals will be due probably the beginning of the spring, and then the funds released in late spring. That's a little bit about our timeline. Next slide. And we share this beautiful piece of art. This is from an amazing young graphic designer named Nayeli Ramirez. And this is about, how everybody in our community can both see themselves in the work that we do and see an increased quality of life as a result of our work together, creating a culture of belonging, creating a place where people are heard, where we are doing some very, very intentional listening and some taking action in ways where people can see that change. So I am so proud to be here tonight working with all of you, and I am going to pass it off to my colleague, Oscar Chavez, to take the next couple of slides.
Thank you so much, Alegria. Good evening, everyone. My name is Oscar Chavez. I'm the Assistant Director for the Sonoma County Department of Human Services. Thank you again, Alegria. Now that we know how ARPA funds will be administered in Sonoma County, I'd like to walk you through the COVID-19 impacts on Sonoma County's health, business, and community. And as we think about how we might prioritize some of the ARPA funding, we want data around our community context to be at the forefront of our minds. We also always want to remind ourselves that people are behind these numbers. These data can bring up sensitive topics, and we want to be sure people focus on the strengths of all of our communities. Also, often certain groups aren't included in data reports because they don't represent a statistically significant subgroup. We don't want people to feel forgotten, and we recognize we need to do a better job sharing data that is truly representative. And tonight, where there are data gaps, we will depend on each other and you to bring stories forward to be sure that everyone is truly represented in our data. Next slide. Before we dive into our specific topic areas, I want to talk about community level data. In 2014, our community released the Portrait of Sonoma report to highlight disparities that exist in our community that keep many of our residents from accessing the resources they need to live a long and healthy life. And to understand disparities along race, gender, and geography, we use the Human Development Index to understand the level of access communities have to opportunities. And this is an index that's developed by Measure of America of between 0 and 10. Communities where we see a low number are communities that are living furthest away from opportunity. And this slide illustrates that if you live in East Bennett Valley, you have a greater access to opportunity versus census tracts within the Roseland community. The index is used to create a scale of 0 to 10 to highlight regions with greater access to opportunity. And HDI is a combination of data related to health, education, and income. It is different than GDP in that it focuses on measures of well-being. We really want to understand what are the contributing factors that can maintain healthy communities and healthy environments. And currently, we are working to update these data in a new, smaller report to be released in November. And I want to share with you a little sneak peek of what that data looks like. Next slide. When we look at the census tracts of East Bennett Valley and compare them to the census tracts in Roseland Creek, we begin to see clear disparities in the data. One might ask, what is causing the differences in life expectancy between the two neighborhoods just 2 miles apart? This slide shows some of the important social, economic, and environmental influences on health outcomes in these two neighborhoods located in Santa Rosa. We can see how these influences contribute to a difference of about 5 years in life expectancy. And we can begin to think about the kind of policy choices or policy changes that we can institute to help grow opportunities in those neighborhoods with a lower Human Development Index score. Next slide.
Oscar, can you slow down just slightly for the translator, please? That would be great. Thank you.
Sure. So now I'd like to turn it over to the Department of Health Services Equity Program Manager, Denia Candela, to tell you about the public health response to the pandemic. Welcome, Denia.
Good evening. Thank you, Oscar, for the opportunity to be here. Throughout the pandemic, we've really seen disproportionality and impacts of community of color, also specifically during the public health response. And as we see the county of taking a center through hardest hit on Black, Indigenous people of color. Over the course of the pandemic, we've seen that the Latinx communities carries the biggest hit in comparison to their population size here in Sonoma County. I will notably say that those trends are in line with what I've seen nationwide and also statewide. In this graph that is in front of you, we're able to see the Latinx community at high rates right there of 13,403.83 in terms of numbers for when we look at it through a disproportionality lens. It's important to acknowledge also the important work of the Latinx Health Work Group, who actually now is the Health Equity Community Group, as they supported the work of the department in ensuring that we looked at our data from a disproportionality lens. Proceeding there back to the graph, we're able to see our Pacific Islander community and right after also our American Indian and Alaska Native, and proceeding thereafter our Black and African American community, Asian, multiracial, and white. Next slide. During the last 60 days, we were able to see an uptake of cases throughout community of color as well. And it's important to note the pandemic still existing crisis, and we continue to develop strategies that are rooted in community design and knowledge, while also looking at the disparities that we're seeing when we look at things through a lens of a 60-day historical perspective. Pacific Islander have seen updates, and we're able to see a gap now that is up in our numbers, up in the green line. Then thereafter, Black and African American communities, thereafter American and Indian Alaska Native. So this kind of paints the story for the last 60 days, and we're able to continue to see those disparities again. Next slide. When we look at the disproportionality of hospitalizations and deaths for our Latinx community ranging at 735, and then even though they make up 27.3 of our population here in Sonoma County, it's important to note that disproportionate impacts with worse outcomes still high along communities of color when we're looking at critical markers of health and just overall the impact of the pandemic, even when we're looking at worse outcome, which would be death. And we looked at proceeding and thereafter. I won't go through the whole graph, but going into other communities as well, we look at our Black and African American community with 42 hospitalizations and 2.4, that is a 2.4%, even though they make up 1.3%. So there is a huge disparity in terms of impact when we looked at death and hospitalizations rates in the county. Next slide. Next slide. Regarding vaccination rates, we've seen an increase of vaccination rates and we continue to make progress, but it's important to know and recognize that we are still seeing disparities along the multiracial groups as well as our Latinx population. The good thing to note is the importance of the work that has happened through the promotoras de salud or community health workers who've actually helped and supported and been at the forefront or looking further from our existing safety nets that we typically lean onto to get the information out there. We see disparities biggest within our Latinx population and then our multiracial group as we're looking at these numbers. 25.9% are Latinx community, and then the biggest gap we're seeing is 59.5 along those in the multiracial group. Next slide. And finally, we're looking at exposure based on exposure in terms of occupation. Our essential workers are at our greatest risk of COVID-19 and subsequent household transmission. In Sonoma County's 19 case data, the majority of cases working in agriculture, cleaning, janitorial, food and beverage production, manufacturing, and sanitation of public identified as Latinx. So it's a confusing a little graph here, but we're able to look at the red as having the race and then our Latinx population really closely monitoring what that looks like in terms of impact, in terms of occupation. That is it for my part of the presentation. I will pass it back to Oscar. Thank you.
Thank you, Dania. And if people have questions, you can put them in the chat and we can answer them during the breakout sessions. So now that you have a better understanding of the public health response and what that looks like, I'd like to invite Sheba Person-Whitley, the Executive Director of the Economic Development Board, and she's going to tell us how the business community has fared during the pandemic. Welcome, Sheba.
Thank you so much, Oscar, and thank you to all the community members for giving time out of your busy schedules to be here with us tonight. So I will be brief and give you the highlights of what we have seen in the business community here in Sonoma County. Early on in COVID response, the Economic Development Board contracted with Dr. Rob Eiler of Sonoma State University and Dr. Marlene Orozco out of Stanford University. And the purpose of this was really to look at the impacts of COVID-19 and also look at the projections of what recovery might look like. So the slide that you see right here represents occupations. And if you look at the biggest impacts, food preparation took over a 20% hit. So that means that over 20% of the people who worked in food and occupation, food preparation and services related to that, we saw that over 20% decrease. Personal care services, so if you think about your salons, your barbers, your stylists, nail shops, those, you see over 20% decrease there as well. Sales and other related services down by 12%. Office and administrative support over 10%. And I think people assume, oh, if you worked in an office, then everyone was still able to work. And clearly we see that that was not the case. There was still a huge loss there. And this is the year, period from 2019 of May through May of 2020. You see production there as well, arts and design, over 7%, and education. We are continuing to hear about challenges around childcare providers, teachers, and others. I do think it is worth also pointing out that when you look at the two biggest drops here, that is food preparation and personal care services, that in Sonoma County, food preparation and service related, 38.8% of the people who work in those occupations are people of color. And when we look at personal care services, 38.4% of the people who work in those occupations are people of color. So I think it just demonstrates, again, one more data set about what we've all been hearing about the disproportionate impacts. Next slide, please. So this slide is about the forecast. A big question that a lot of people have been asking, when is it going to be over? There are some people certainly who think that COVID is, that we're out of the woods. We've heard that narrative throughout the country, and certainly we're not there yet. So when we think about recovery, what does that mean? It really is to state in simple terms, if you were to go back to how you were before the pandemic started. So that would be most likely December 2019, rewind all the way back. How long is it going to take our community to get back to that level? And you see here, this is probably not going to surprise you that accommodation and food service, even by the year 2024, is projected to still be down by over 9%. Education services projected to still be down by over 7%. So I think it is critically important as we think about the one-time funding that we understand the broader impact that we've seen in the business community and the people who are in those occupations supporting those industries. So with that, I will turn it back over to Oscar. Thank you.
Thank you so much, Sheba, for giving us information about what's happening with our business community and the impacts of COVID. I just want to highlight some additional data points related to the impacts of low-income households and individuals in our community. Next slide. Many of you know our CalFresh program. It's administered by the Human Services Department. This is California's food stamp program. And we can see that applications nearly doubled during the first shelter in place compared to the same months from the previous year. Next slide. We also noted that calls to 211, the county's information and referral services, also increased. During the pandemic, 211 call volume for help increased significantly with requests for housing assistance, healthcare, income supports, food and meals, and utility assistance. And the area where we saw the biggest increase in calls compared to pre-pandemic was for support with income assistance. That makes sense since we were all required to shelter in place and many individuals did not have the ability to go to work. Next slide. We also want to highlight some of the current challenges with access to childcare. We know that parts of Santa Rosa, Sonoma Valley, and West County, along with small areas of Windsor, Petaluma, and Runner Park, have inadequate access to childcare. The majority of Santa Rosa, including Roseland, South Santa Rosa, and Coffee Park, are childcare deserts. And in Sonoma Valley, Better Springs and Agua Caliente are also childcare deserts. They are called deserts because they represent areas where childcare demand exceeds the space available for in-state licensed childcare programs. We know that the pandemic has put a huge strain on our childcare sector. And based on this data, we know that many of our in-home childcare providers will not be reopening, making it much more difficult for parents to return to work, especially those that have to work non-traditional work hours. We also know that prior to the pandemic, we had a learning gap between our Latinx dual language learners and their white counterparts. The loss of childcare slots, and because of the pandemic, we had limited access for homes, limited access to needed technology, which caused an even greater divide among race and class in many of our communities. Next slide. The data we've shared is powerful, but we know there is still more to be learned. We want and need to learn from you and your experiences. Where have you seen successes, and where do you see needs in our community response to COVID? We'd like for you to share those experiences in facilitated breakout sessions. We'll be recording all of your input and using it to inform the Board of Supervisors as they set priorities for ARPA funding. You'll have about 50 to 60 minutes in your facilitated breakout sessions. To participate in the English breakout session, please accept the invitation to join a breakout group that you'll be receiving shortly. And if you would like to participate in Spanish in one of the Spanish breakout sessions, please remain in the main room. Do not accept the breakout session invitation you're about to receive. Again, we want to thank you for joining us and sharing your thoughts, and we'll see you back after the breakout sessions to report out and to take a brief survey.
So welcome back, everyone. I hope you had really fruitful conversations this evening. So I'm going to turn it back over to Oscar, who's going to lead us in a little bit of the next portion of the agenda. We're going to ask you for some additional feedback on potential funding areas, and then I will lead you all in the report outs.
Great. Thank you so much, Kelly. And as Alegria pointed out earlier, within the ARPA funding, there are areas that are eligible for investments. And we want to take a quick poll and get your input on the priorities. So if you could just read these really quick, and Joni will be administering a poll here shortly. And if you could just prioritize based on your discussions and what you see in your community, where you think we should be investing our ARPA funding here in Sonoma County. And first of all, thank you, and we apologize for the challenges that our poll continues to have.
Yeah.
But we'll get it. We'll get it right next time. So let's do a little bit of report out, and we'll invite the groups to very briefly share a couple of highlights from what you discussed today.
And
Do we
Oscar,
have
I
a-
think we're gonna,
What's that?
I was just gonna say, if we could practice a little bit of centering the most disproportionately impacted folks in our community, we're gonna start by reporting out with the Spanish language group.
Great.
I was gonna, Oscar, you're up.
All right, so that is me. Let me grab my notes. Okay, so our group was the Spanish-speaking group, and one of the things we heard is that the members who were there were not surprised at all by the data that they saw. It only reaffirmed the realities in which many of our community lives in. Some of the challenges raised were around the cost of living and the fact that housing is really high, and that the rents keep increasing and the wages have not. So members of our group are interested in seeing greater protections, particularly around rent control, to make sure that families who work here and live here in Sonoma County are able to do so. There is also a desire to invest in communities where we saw the greatest disparity. For example, in Roseland, people expressed a desire to have Roseland be equal to East Bennett Valley, but raise concerns around gentrification and want to make sure that people aren't forced out as the community changes. There was also a recognition that childcare is really important, but there's a lot of barriers. We lost a lot of preschools, but the cost makes it very difficult, especially for working families. And so they'd like to see more investments in childcare in our community. And they also highlighted some of the programs that are working, like CUDA and the DocuFund, and investing in more programs that have that are not so restrictive. So look at the kinds of requirements that are being asked, and think about how we can streamline them to make them more efficient and effective. So with that, I'm going to turn it over to the next group. We had a lot more, but we'll type up our notes and hand them over to Kelly.
All right, thank you, Oscar. And next, Helen, would you like to report out on your group?
Yes, and I agree with Oscar. I almost feel like just scrunching everything down into a couple of lines doesn't do it justice, but there was a lot of really rich conversation that happened. So again, I want to thank people for participating. I noticed the three areas that rated highest on the poll: education, housing, and employment, basically, were also really rich topics that came up during our conversation. There was talk about the disparities in healthcare and how that was a major challenge for the community, especially for the communities of color. And how also the healthcare issue links to the homelessness, and how when the homeless don't have healthcare and they really can't get the services they need, there becomes a criminalization of the homeless, which in turn just creates this wheel of round and round we go. And education was also a big topic, speaking about the impacts to the non-English speaking students and how they were really disproportionately impacted by COVID.
Thank you, Helen. All right, next, Bella, would you like to report out on your group?
Yes, thank you. So just want to echo what Oscar and Helen have said about, condensing what everybody said into just a few bullet points, and thank my group for their participation. I think three of the things that, really came up in our conversation were around education, and kind of specifically like mental health for our young people, and also for their families, and how that kind of had a ripple effect and our teachers as well, and our childcare workers. We talked about employment for our frontline workers and the wage gap and having livable wages for, people who are employed in this county. And then we also did have some conversation around the effects for our seniors and their mental health and the impacts that COVID has had on their ability to socialize. And definitely more within those, but those were some 3 major points.
Thank you, Bella. All right, now we'll have Ethan.
Thank you, Kelly. Our group talked about quite a few things, as you've heard other people say, and there is a challenge to getting that all down and out in 2 points. I'll stick primarily at the recommendation of one of our group members with sort of some funding items, with the realization that, what kind of came to our collective consciousness during the pandemic was, our critical and essential workers, oftentimes low paid, sharing housing, and how that can oftentimes, it can contribute to rapid spread, and that ARPA is the opportunity to ensure that we do not continue to leave these folks behind in the future. Some other pointed discussions around funding were to continue to get money out to renters who are not able to pay for their housing. That's a critically important piece. To invest in groups like the Springs MAC, make sure that clinics are well funded, and to continue to fund youth programs.
All right, thank you, Ethan. So that is our report out this evening for that section of the agenda. So I just want to thank everyone for your excellent comments and feedback. This is really helpful as we move forward with thinking about how we might prioritize the ARPA funding. And now I'm going to turn it back over to Alegria to close us out for the evening.
My goodness, Kelly. I was just glad that in my little group, we got bounced out of our breakout before I started to get emotional with how much love there is for our community being expressed here tonight, and how much of a vision there is for what a future would look like as we work together with a particular focus on, those folks who have shouldered a much heavier burden during the pandemic than others. And it's with that real loving focus that I'm excited to end tonight, and with a lot of gratitude for all of you for coming out and spending a few hours with us to really make this process reflect who we are and what we want to see. So many, many thanks. Thank you, Jake. There's a lot of good information here on this slide. To learn more about the process and to stay up with everything that's happening, the ARPA website under the CAO is a great place to go. And you're also welcome to send us an email, arpa@sonoma-county.org. We're happy to share data. We're happy to share any of the information that we provided to you tonight. And Fred, we will get you the poll, I promise. Okay, thank you so much. Muy buenas noches.
Thank you, everyone.
Thank you for hosting.
Thank you, Carolyn.
Bye, Oscar.
Bye.
Good job, all. We'll see you next time.
Thanks,
Jack.
Jack.
Jack, bye.
Bye.
Gracias.
Sí, gracias, Denia.
Muchas gracias, Denia.